Good morning. My name is Beth Schweitzer. I am the Health Commissioner here in Seneca County. We will be doing these live podcasts every Monday, Wednesday, and Friday at 10:30 in an effort to bring you, the citizens of Seneca County, the most up-to-date information about the COVID-19 outbreak and to provide you with updates so that you will know what is happening here locally as well as in the state of Ohio. The first thing I want to do is thank all of the residents of the county for their part in helping to prevent the spread of the coronavirus known as COVID-19. I do understand it hasn't been easy to change our normal routine way of life. I know it has not been easy for businesses to have to shut their doors, to face the loss of income, to let employees go who will face the loss of a paycheck. But I want you to know that the efforts you are making are going to make a difference. I also want to thank the community partners with whom the health department works. There are just too many to name, and a few of them were going to be with us this morning, but with the governor's order as of yesterday asking us to stay at home, limit our travel and contact as much as possible, we felt it was best not to bring them in. But I know they are behind me. They have supported the health department in the decisions and the suggestions that we've made, and I really appreciate all that. Everyone in the community has been working together to keep us all safe. The second thing I want to do is I want to apologize to anyone who may have seen me as overzealous or perhaps a little too intense in my efforts to keep our community healthy and to prevent the spread of COVID-19. Please understand that I have your best interest at heart as the decisions that are being made is to protect all of you. This has been a rapidly evolving situation for the past several weeks and months worldwide and locally, and it's been difficult to keep those communications going. It seems as if recommendations have been made, communication is released, and new recommendations come out and the process needs to be repeated. I know this may have been confusing to both my partners and my community. So the goal of bringing you this podcast is to try to alleviate some of those problems. To start, I want to give you a local update. At this time, we have no cases of COVID-19 here in our county. At last count, 24 tests have been performed, done at our two local hospitals, Tiffin Mercy and Fostoria ProMedica. 3 of those have gone to the Ohio Department of Health laboratory, and the rest have gone to commercial laboratories. We have received reports on 6 of those, with all 6 being negative, and we have pending 18 of those. On the state level, as of 2 p.m. yesterday, March 22nd, there were 351 cases in 40 counties. We have 83 people who are hospitalized and have had 3 deaths. The age range of cases is from 1 year of age to age 93. Because it seems that so many of the questions that have been coming up have been about testing, not only here but throughout the state and nation, I would like to spend just a little bit of time talking about that. In order for a case to be considered positive, there must have been a test performed. And there are a number of reasons why those tests have not been performed on everyone who would like to have one. To be considered for a test, a patient must have the major symptoms of COVID-19, which are a fever above 100.4, a cough, and respiratory distress such as shortness of breath. It's not until these symptoms appear that we can reasonably be certain that a test will be accurate. Even if a person has been in contact with a known case, a test in those early stages may fail. And I want to tell you why. In the early stages, what we call the viral load may be too low to be detected. The amount of virus that has been produced in the body may be too small. And it takes them a while to build up. So remember, the incubation period for this infection is 2 to 14 days. Without major respiratory symptoms, there may be very little detectable virus in the nose and the throat, the places from which those samples are taken. And the secretions from those areas may not be plentiful enough to get an adequate sample. Another thing that has limited the testing capabilities was when the virus first emerged, Remember, it's a new virus, and therefore there were many things that we needed to learn about that. Research had to be done on the development of a way to create a test to test for the virus, and it takes some time to do that. When it began in the U.S., only 2 labs at the CDC, the Center for Disease Control, were performing the test, or they were the only ones actually permitted to do that. And when they began to expand to state health departments, there were some issues with the initial versions of the kit. I can tell you in the case of the Ohio Department of Health, they received a limited amount of the substance needed to conduct those tests, therefore a limited number of tests could be processed. That's why their guidance on who can be tested through their laboratory is very stringent and very specific. Now, since then, additional commercial labs have developed their own tests, and so that number has been growing. But of course, they have to be approved through the FDA to be allowed to conduct those tests. Right now, the Center for Disease Control's guidance in testing is for hospitalized patients who have signs and symptoms that are compatible with COVID-19. This is to inform the decisions related to infection control in the hospital. Remember, we cannot afford to have our healthcare workforce become infected. We need them to continue to provide care for the volume of people that could and need to be hospitalized. Symptomatic individuals, such as older adults and individuals with chronic medical conditions or who have low immune systems that prevent them from resisting infection, are also important to be tested, because they're at risk for lower outcomes, poor outcomes. And anyone, including healthcare personnel, who within 14 days of their symptoms starting have had close contact with a suspect or lab-confirmed case of COVID-19 or has a travel history to affected areas. We also are testing those who come from our nursing home facilities because of the close quarters that they have. In case there's an outbreak, we want to make sure that we detect all of those possible positives. Right now, they are not recommending testing for people with mild or moderate symptoms and without any risks for adverse outcomes. And also, of course, people without symptoms would not be a wise choice. We are now in the community transmission stage. The source of infection may be unknown, in other words. A person who does not have the history of a travel to a highly endemic area would be one that we would not know, perhaps. There will be people in our community with COVID-19, and we are expecting it. We have been preparing for it, and we know that there are cases nearby. Hancock County just announced their first case yesterday. Wood County did as well. And earlier in the week, Huron County announced their case. So we know that it is out there, community spread is there, and I would like to be able to say that we would not have any cases here, but of course I cannot do that. We are expecting it, and we will be prepared for that. So this is where it becomes so important that we follow the guidelines that will prevent the spread of infection. And we've talked about that before, so I'm going to repeat that. Social distancing or physical distancing, keeping at least 6 feet apart from people when you are going somewhere, is essential. Better yet is to stay home if at all possible. And as we know, the governor and the director of health, Dr. Amy Acton, yesterday issued orders that we are to stay at home if at all possible. That order is very lengthy. It provides the essential services and essential businesses that must continue to operate. We will get that on the website. I have that order in print, and you can call the health department at the number that we have up here if you have some questions about whether you are an essential service, an essential business or not. We want to practice good hand washing. I know that sounds so simple, but good hand washing for at least 20 seconds with soap and water will help rid the hands of that disease, and that will keep that germ off of counters. It will also keep it off of our face should we touch it. Try very hard not to touch your face. Your eyes, your nose, your mouth is where that germ may enter. And I know that's tough to do. Until I started being very conscious of this, I did not realize how often we do touch our face, but that's very important. Washing those hands before we fix food or before we eat is very important as well. You want to cover your sneezes and your cough with a tissue. Discard that tissue and wash your hands. If that tissue is not available, do it into your elbow and to your sleeve. Above all, if you are sick, stay home. I have just received a call from a very concerned citizen who was out this weekend before the order was given to stay at home, and they were in contact in 2 different places with employees who were visibly ill. I know many employers feel they need to have their employees at work, but it is crucial that if you have an employee that is sick, they must stay home. If you have any of those symptoms I mentioned before, you need to stay home and self-isolate for 14 days and contact your healthcare provider to see if they have any recommendations for you. If you are seriously ill, contact the hospital before you would go to the emergency room so that you can prepare, or they can prepare appropriately for your arrival. These orders for the closing of the numerous businesses and entities are being enacted in an effort to prevent the spread of this virus. All businesses that are not essential, again, are ordered to be closed. I would like to remind each business that is allowed to remain open to follow good health practices to prevent the spread of infection within your workplace. And those include workers no closer than 6 feet from each other. Try to separate your workers so they're perhaps in different offices. Let them work someplace else. If you have employees that can work from home, that's advisable to do as well. If they are coming into work, you should continue to monitor their temperature. If they have a temperature of over 100.4, they should be sent home. Have plenty of hand sanitizer available and allow them to take those breaks to go to the restroom and wash their hands. It's a good idea too to separate designated hours for those who are elderly, for those who are more at risk for contracting this illness and having poor outcomes. Provide the public with the services that you can provide by phone so that they will know that they can call. I will tell you that as of today, the Seneca County General Health District has decided to limit public into the building. We will no longer be allowing public into the building. We, however, do want you to call that phone number we have up here. You can call extension 300. They will get your call directed to the correct department. If it is something you physically need, we will arrange a time to meet you at the door with that paper or whatever it is you need while keeping that 6 feet distance. Let us know individualized cases and we can make efforts to serve you to the best of our ability. I'm just really asking you to follow these guidelines. If each and every one of us do our part, we will prevent the spread of COVID-19 in Seneca County. I want to tell you we will come through this. I haven't been in Seneca County very long, just 6 years, but I have come to know it as a community that cares about their fellow citizens. We're a strong community, we're a resilient community, and I promise you that I will do everything that I can in my power to help this community get through these uncertain times. And I'm sure that you will help your fellow citizens get through this rough time as well. As I said, you can certainly call us here to talk to somebody, ask questions. I will give you a couple of recommendations to go to credible websites. One is to go to the Centers for Disease Control, the CDC, and the other place to go is to the Ohio Department of Health's website. They have a special section for coronavirus, and I would encourage you, if at all possible, to watch the press conference that's released daily by Governor DeWine and Dr. Amy Acton of the Ohio Department of Health as they inform us about updates and about the coronavirus. One question I had, and you can ask questions, you can put them on Facebook and we will try to get those answered. One question was about the number of tests that are being done, and if 10% of people have the disease, does that mean, for example, that 3,510 tests have been done in Ohio because we've had 351 cases? The figures I found most recently were 13.6%. So I can't say definitely if it is just 10%, if it's that higher percent. I will continue to search for this information and see if I can come up with a more accurate answer to that. But I do encourage you to place your questions on Facebook, and we will answer those as best we can. And I look forward to seeing you again on Wednesday. Thank you.